So the first question here says, can anybody go on an exchange? Or are you only allowed if you're under 400% of the poverty level? So yes, anybody can go on the exchange, but what the slide I threw up there is why would you want to if you're not eligible for a subsidy? They're not working, you're not going to get any assistance, and there's no plans available there that aren't available to you off the exchange. So every plan that's available on the exchange is available at the same price, same coverages off the exchange. And there's a whole bunch of other plans too. So the exchange is going to have less plans. They're going to be with these metal tiers that we're going to talk about, and you're not going to get any help paying your premiums anyway. So most people who are not eligible for a subsidy are going to want to probably continue to buy insurance the way they are. Now, if you're one who likes to go bang your head on the wall and try and get on a website that's not working to get the same thing you can get off of it, then you can do that, though. Okay, so how do employees sign up for subsidies? And are people who work in an office with less than 50 employees eligible for subsidies? So yes, the subsidies are available up to 400% of the poverty level. 50 employees, no employees, whatever. Anybody is eligible for a subsidy unless they're up to 400% of the poverty level, unless they're offered affordable insurance, 9.5%, remember, was affordable, at their employer, okay? So anybody can go if they're eligible for a subsidy, as long as your employer's not offering you coverage already that costs you less than 9.5% of your income. So if yes, how does the employer process subsidy and payroll? How does the subsidy reported by payroll service? So we did go through this. So the subsidy's got nothing at that point. If you've elected to get a subsidy, the only place you can get the subsidy, first you have to be under 400% of the poverty level, so that grid we threw up there. If you're there, and if you're not offered affordable insurance by your employer, then you go to the exchange, not through your employer at all. It's got nothing to do with your employer now. You're going to go to the exchange. We're recommending that you go to the exchange with our assistants. We will help you shop on the exchange. We'll explain the plans you're looking at and what subsidy you're eligible to you. That's all at no cost than if you try to muddle through that all on your own. So the subsidy is just a reduction in your premium on your bill. So eventually you're going to get to a point on the exchange or the marketplace where it says you're eligible for a $300 a month subsidy, or you're eligible for a $100 a month subsidy, whatever it says. Then you go shop plans. Whatever the premium on the plan is, you subtract your subsidy, that's what your bill's going to be. So it's just going to be a reconciliation on your bill. It's got nothing to do with your employer in that situation. The subsidies, again, are only available on the exchange. You can go out if they ever work. They're not working right now. I don't really recommend you to waste any time right now. They're just not working. We go on them 5-6 times every day just to check out if we can get anywhere, and we can't, okay? But if they ever are working, that's the only place you can get a subsidy. But if you're not eligible for a subsidy, I really see very little reason. The plans are what we're seeing on prices. The prices are high. The co-pays and deductibles are, I just had a gentleman come up whose son got to look at a plan, $5,000 deductible for his bronze plan, I think is what he told me, or the premium was $5,000, a $4,000 deductible. So deductibles and co-pays are, in this new metal tier world, you're not going to be excited about if you decided to go that route and be insured in the market, you're not going to be excited about your out-of-pocket exposure. Beyond the premium increase, your out-of-pocket exposure will also go up in these plans as you start looking at them. Will we be able to have employees contribute more than 9.5% of their wages toward their medical premium? So I'm going to talk as if, which is true, most dentists employ less than 50 people, right? If you employ less than 50 people, then the employer mandate does not apply to you, which means the 9.5% does not apply to you. So the answer to that is yes. If you employ less than 50 people and you want to have a health plan, you could still have a health plan that required someone to, say, pay 15% of their income to get into it. Now, that person then has the option to either join your offer. You're not in any trouble for doing that because you're under 50. That person then has the option to say, do I like the plan Doc's offering me better, or if I am eligible for a subsidy, would I rather go on the exchange and look at the two options, compare them side by side? That would only be if they're eligible for a subsidy. Again, if you're not eligible for a subsidy, if you're making more than $45,000 a year, then chances are you're going to, even if Doc has asked you to pay 10 or 15% of your salary, you're better off with that option than trying to go on the exchange. It's going to be a higher premium, higher copays and deductibles, and you're not going to be eligible for a subsidy. If you are eligible for a subsidy, that's when you might want to look on the exchange. But docs are not required. If you employ less than 50, you completely ignore that 9.5% rule, okay? Did I understand you right? If an employee elects to go to the exchange rather than use your offered health care plan, does the employer have to pay a $3,000 fine? So you only understood me right if you also add the caveat that you employ 50 or more people, right? Those fines, that pay or play, both of those fines, the $2,000 fine and the $3,000 fine, are only for employers of 50 or more. If you employ 50 or less, you don't have to offer coverage, and similar to the last question, it also doesn't have to be, quote unquote, affordable, which is the 9.5% rule, okay? Again, just because you don't have to, doesn't mean you wouldn't want to attract and retain good employees. So when purchasing online insurance through the government, who offers the policies? Do insurance companies get any kickbacks or benefits from being on the exchanges? So, kickbacks or benefits, I don't know if that's the right word, but, like any business, the more patience you have, the more profitable your practice is. To an insurance company, the more insureds they have, the more profitable their business is. So that's their incentive to consider participating on the exchange. But I can tell you that a lot of major, the Aetnas and the Uniteds, some of the big insurance companies have either very limited in their desire to be on exchanges. They've pulled. They were going to be on the New York exchange. They decided not to be. So ultimately, all these reasons that we're going to talk about here in the next half of why we think premiums are going to go up also scare insurance companies. They don't like that adverse selection scenario I talked to you about, or they're insuring a burning building. They don't like that. So some companies they're not going to play on the exchange. They're not going to participate. Others have decided to get into it. It's a business decision, and yes, those that decided to get into it think there's going to be some benefit or profit or kickback or whatever you want to call it to them participating on it. Is the health insurance through the exchange less expensive than what I currently pay through the MDA? Is the coverage the same through the exchange? So, again, recall that we can't get on the exchanges. And even prior to getting on the exchanges, we were all licensed and approved to help people on the exchanges. But on September 30th, we had not seen one product or one premium, okay? So these things were going to open October 1st, and nobody had seen a policy or a premium yet. So on October 1st, they opened, and as we've described several times here, we all ran out online to try and see what was available, and the system crashed. And the system has been crashed ever since then. So what we have been able to do then is on the side, not on the exchange, we have been able to look at premiums and coverages, okay? So we've not actually had anyone experience this directly yet, but we have looked at it. So what I talked about earlier, the coverages are worse. These bronze level plans are $3,000, $4,000, $5,000 deductibles before any coverage kicks in. We're going to talk about that here in a little bit when we go over the actuarial values. We're also seeing in the individual market premiums go up. Is Tim over there? All right, Tim just gave me a couple examples of people he's working at. So these are the people, remember we had the color card that nobody was here yet. They're the people, as we go through this, are going to be the first ones impacted by this. They're the first ones to lose the policy they have right now, and they're just getting the notices right now, and they're getting to see what their options are. And Tim has got a couple of PO'd people, all right, because their premiums are going up $150, $200 a month, and they're getting less coverage. So that's what we're seeing initially, but we're just sticking our toe in the water of looking at these things, okay? Because you can't get online and see it. They didn't publish any of the information prior to opening it. And every scenario is a little bit different as well. So it's hard to answer that question directly, but we're going to go through this extensively in the second half and show you why we think premiums are going up, coverage is going down in the insured market, and what we're going to do about it at the MDA. Medical device tax. What is the current ruling for labs and dental offices? So that's kind of a vague question, I guess, but the medical device tax is the 2.9% tax on medical devices, all right? It's supposed to be for the manufacturer or the importer of the medical devices. So the biggest impact on most dentists is just that you're using devices in your office that are getting hit with this tax, whether it's from your dental lab manufacturing something or somebody importing something from overseas or what have you. And then those people are probably adding onto your bill when they charge you for it. So the cost of some of the products and services that you're using are being increased. There's a couple gray areas, so you're not manufacturing something when you put an amalgam filling in or something like that, or even braces or something. But CEREC machines, like if you're making your own crown or bridge or something, that's a little bit more of a gray area if you might be manufacturing a medical device or something. So I'm not an expert on that subject. And keep in mind, any of these questions and any of these taxes and anything we're talking about, the government is literally making this up as they go along. We get hundreds of pages every Friday. My weekend reading enjoyment, is, whatever the latest batch of, this is what we really meant. Here's the fine print, basically. So the original law was 2,000 pages. They've issued 30 or 40,000 more pages of, this is what we really mean. And they're issuing it every week. So it's a moving target at best, which is a good segue to this question. So it's a moving target. How do we budget for health care if you plan on retiring before 65? So, the world is changing right now, and I don't know where it's going to settle. I don't know if next week or 2 weeks from now the government says these exchanges aren't going to work and we can't get them fixed, and so no one has to sign up for insurance after all. I don't know that. Given all the uncertainty, my best answer to that question is, save a substantial amount of your retirement, earmarked to pay for health insurance. We're going to still have options available at the MDA. We're going to try to, and something will be available out on the open market. Health insurance is not going to go away. You're going to always have the chance to buy it. It just might be that you're paying more and getting less for the money. Can my relatives, mom, dad, brother, buy insurance through the MDA? So, two sides to the answer. Our exclusive MDA plan, that's only for members and staff. But everything else, we're licensed, regular licensed insurance agents, and we, as I've said a couple times here, we have access to everything on the market. Everything that's on the government's market, but everything that's on the old-fashioned or open market or the off-exchange market as well. So we can help, your kids, your relatives, especially if they're subsidy eligible, if they ever get these websites fixed, we can help on subsidies. And then if they're not subsidy eligible, we have access to the Blue Cross individual product portfolio, the off-exchange product portfolio, which again, remember, everything on the exchange is available off the exchange at the exact same prices. Buying either place and using the agent doesn't cost you 1 cent more to get professional advice than trying to muddle through it on your own. Can the template for exchange notice, do we pass it out or does employee need to sign it and save it. So it is required that you want to get some acknowledgement that we received it. When we did it here at the MDA, we emailed it to everybody, and on your Outlook there's a little voting tab where you can say, yes, I received this, or no, I didn't. So that's how we verified. Everyone just clicked yes that they got it. If you're just a small office, if you just want to make your own little form, I handed these out and have everybody sign it, throw it in the file, that probably wouldn't hurt either. Remember, the government came out and said they're not going to fine or penalize you. I'm not saying you shouldn't do it, but the documentation doesn't become as important then, since there's no teeth behind it. For small business owners, what is the shop option in the marketplace? Okay, so we talked, when I presented, and this is a good question because I totally ignored the shop part of it. We talked about the exchange, and we only talked about the individual market and that portion of it. That's where the subsidies are eligible. A second half of the exchange is the shop, which is small business coverage. And the reason I ignored it is the same reason I talked about earlier, of if you're not eligible for subsidies, why buy on the exchange when everything's available at the exact same prices off the exchange, and you can buy it the old-fashioned way by talking to a live body and having someone come out to your office and look at it, all those kind of things. The only exception to that is for some businesses, there's supposed to be a tax credit available in the shop. That would be basically if your average wage in your office is less than like $20,000 a year, and you're willing to pay for people's insurance. That's the one exception. In Michigan, the shop exchange on Blue Cross, if I'm remembering the numbers right, they put 2 group products on the shop exchange. Off the exchange, there's 36 products plus those 2. So that gives you an idea of why we're not really big on the shop exchange, okay? Everything that's available on the shop exchange is available off it, plus 34 more plans, okay, in Blue Cross's world, and the same thing going on with other insurers as well. The shop exchange has been delayed, I don't want to say the date, in many states. It's not even going on right now. Eventually, the fine of $95 per person, or 2.5% of household, is that everyone in the household or just individuals? So it's everybody. So so if you have a family of 4 and all 4 of you don't have insurance, it's 95 times 4 is the penalty, okay? And same with the percentage of household income, it would be added up or aggregated. Could I go back over the penalties for not buying insurance? Okay, so this is the individual mandate. So in year 1, right now, January 1, 14, the penalty is the greater of $95 per uninsured family member, or 1% of income. So that, someone making $40,000, that'd be $400 instead of $95, right? Okay, it aggregates up from there over the years. Yes. So the question was, on a 90-10 plan, if I have a $100,000 hospital bill, does that mean I end up paying 10 grand? So the answer to that is no. So all the plans are capped at some point on your maximum out of pocket. Usually it's around $6,000 or $7,000 per individual, $12,000 per family. But typically most people don't ever hit that level, so when they calculate the actuarial value, it still works out 90-10, even though you might not end up paying 10 indefinitely, okay?